What if your dog has been asking for help and you simply didn't recognize the signs? A single scratch behind the ear, a tiny black speck in his fur that you brushed off as dirt, a little extra restlessness at night. These moments seem small, but sometimes they're the very first clues that something is happening beneath the surface. Something your dog can't tell you about in words, but is trying to show you anyway. By the end of this video, you'll know exactly what to look for, what those signs might mean, and what you can safely do about it, starting today. Today we're going to talk about how to spot the early warning signs, what might be causing them, when home care is appropriate, and when it's time to call your veterinarian. Why this matters. Here's something important to understand about dogs. They are masters at hiding discomfort. It's an instinct passed down from their wild ancestors. In nature, showing weakness can make an animal a target. So your dog isn't ignoring an itch because it doesn't bother him. He's often doing everything he can to push through it quietly. That's exactly why early detection matters so much. Fleas and ticks aren't just a nuisance. Left unaddressed, they can lead to skin infections, allergic reactions, and in the case of ticks, exposure to serious tick-borne illnesses. The encouraging news is this: when caught early, these problems are almost always manageable, and prevention is often far simpler and far less expensive than treating a full-blown infestation or illness later on. So let's walk through what to watch for, one sign at a time. Warning sign number 1, sudden frequent scratching. Real story: meet Bailey. He's a 4-year-old Labrador mix who spends his summer afternoons in the backyard, chasing squirrels and lounging in the grass. One evening, his owner noticed he kept scratching at his neck and the base of his tail, over and over, almost like he couldn't get comfortable. Veterinary explanation: scratching is one of the body's simplest alarm signals. When something is irritating the skin, whether that's an insect bite, saliva from a flea, or a tick attached to the skin, nerve endings send a message to the brain that says, something is wrong here. The dog responds the only way he knows how, by scratching, licking, or chewing at the area. Possible causes. This symptom may be associated with flea bites, tick attachment, seasonal allergies, dry skin, or general environmental irritants. It's rarely caused by just one single factor, which is part of why professional evaluation can be so helpful. What owners should watch for alongside scratching: keep an eye out for red or irritated patches of skin, small dark specks in the fur, especially near the tail base, neck, or belly, restlessness or difficulty settling down, excessive licking of one particular area. When to see a veterinarian. If scratching is persistent, intense, or focused on one specific area for more than a day or two, it's worth having your veterinarian take a look. They can help determine whether fleas, ticks, or another cause is involved. Prevention. Tip: routine use of a veterinarian-recommended flea and tick preventive combined with regular brushing sessions allows you to catch irritation early, often before your dog even shows obvious discomfort. Warning. Sign number 2, small dark specks in the fur, flea dirt. Real story. Luna, a 7-year-old terrier, loves rolling in fallen leaves every autumn. One weekend, her owner was brushing her and noticed what looked like little grains of black pepper scattered near her lower back. Veterinary explanation. Those dark specks are often referred to as flea dirt, which is actually flea waste. It may not sound pleasant, but it's a genuinely useful clue. A simple way to check: place a few specks on a damp white paper towel. If they turn a reddish-brown color, it may indicate the presence of digested blood, which is associated with flea activity. Possible causes. Flea dirt is most commonly associated with an active flea presence on the body. However, general debris, dried skin flakes, or dirt from outdoor play can sometimes resemble it, which is why a closer look, ideally by your veterinarian, is valuable. What owners should watch for: visible movement in the fur, especially near the base of the tail, small reddish bumps on the skin, increased grooming or biting at the fur, hair thinning in commonly affected areas. When to see a veterinarian. If you find what appears to be flea dirt, a veterinary visit can confirm what's happening and help guide safe, effective treatment for your dog's specific situation. Prevention tip. Regular grooming sessions aren't just bonding time. They're one of the easiest ways to catch these early clues before an infestation has the chance to grow. Warning sign number 3, a bump or attached parasite on the skin. Real story. Max, a 6-year-old beagle, had just come back from a hiking trip with his family. That evening, while giving him a belly rub, his owner felt a small, firm bump near his ear that hadn't been there before. Veterinary explanation: ticks attach themselves to the skin to feed, and over time, they can become more visible and swollen. What might feel like a small skin tag or bump could, in some cases, be a tick that is already attached. Possible causes. A new bump on the skin may be associated with a tick, an insect bite, a skin cyst, or another benign skin change. Because these can look similar to the touch, it's important not to guess. What owners should watch for a bump that appears suddenly, especially after time spent outdoors, redness or swelling around the area, your dog reacting sensitively when the spot is touched. Multiple small bumps appearing over a short period, when to see a veterinarian. If you find an attached tick or a bump you suspect could be one, it's best to have your veterinarian remove it properly. Improper removal can sometimes leave part of the parasite embedded in the skin, which may lead to irritation or infection. Prevention. Tip: after outdoor activities, hikes, walks through tall grass, or time in wooded areas, a simple full-body check of your dog's skin and fur can help you catch a tick before it has time to attach fully. Warning. Sign number 4. Red, irritated, or inflamed skin. Real story: Coco, a 5-year-old French bulldog, developed a raw, red patch of skin on her lower back that seemed to appear almost overnight. Her owner noticed she was chewing at the spot obsessively. Veterinary explanation. Some dogs develop a heightened sensitivity to flea saliva. Even a single bite can trigger significant inflammation in dogs who are prone to this kind of reaction. Veterinarians often refer to this as flea allergy dermatitis. In simple terms, an allergic skin reaction related to flea bites. Possible causes. This symptom may be associated with flea allergy dermatitis, general skin allergies, environmental irritants, or secondary bacterial irritation from persistent scratching. What owners should watch for: hot, red, or moist patches of skin, hair loss in a concentrated area, a strong urge to lick or chew at one spot, skin that feels warm to the touch. When to see a veterinarian: inflamed skin that doesn't begin to settle within a day or two or that appears to be spreading should be evaluated by a veterinarian. These areas can sometimes develop into secondary infections if left unaddressed. Prevention. Tip: consistent, year-round flea prevention, even during cooler months, is one of the most effective ways to reduce the risk of these allergic skin reactions altogether. Warning sign number 5. Pale gums or unusual tiredness. Real story. Rosie, an 8-year-old Cocker Spaniel, seemed less interested in her evening walks. Her owner also noticed her gums looked lighter in color than usual. Veterinary explanation. Gums are a helpful window into overall health. Normally a healthy pink, gums can appear paler when the body's red blood cell count is lower than it should be. In significant flea infestations, especially in smaller or younger dogs, blood loss from repeated bites can contribute to this. Possible causes. Pale gums and fatigue may be associated with flea-related blood loss, tick-borne illness, or a number of other medical conditions unrelated to parasites. Because the possible causes vary so widely, this symptom always deserves professional attention. What owners should watch for: gums that appear pale pink, white, or grayish, noticeable tiredness or reduced interest in activity, rapid breathing, reluctance to eat. When to see a veterinarian: pale gums combined with lethargy should be evaluated promptly. While this isn't always an emergency, it's a combination of signs that benefits from a same-day or next-day veterinary visit rather than a wait-and-see approach. Prevention. Tip: routine wellness checkups, including simple blood work, allow your veterinarian to catch subtle changes long before they become visible symptoms. Warning sign number 6. Fever, joint pain, or swollen lymph nodes. Real story. Duke, a 3-year-old German Shepherd, had been noticeably stiff after a weekend camping trip. His owner assumed he was just sore from extra exercise, but the stiffness didn't improve over the following days. Veterinary explanation. Ticks can carry organisms that, once transmitted to a dog, may lead to inflammation in the joints or a general feeling of being unwell, similar to how a person might feel achy with a fever. This doesn't happen with every tick bite, but it's part of why tick exposure is taken seriously in veterinary medicine. Possible causes. Joint discomfort and fever may be associated with tick-borne illness, but they can also stem from unrelated causes such as an injury, overexertion, or another infection. What owners should watch for: stiffness or limping that doesn't resolve, reluctance to be touched near the joints, warmth or swelling under the jaw or near the limbs, general low energy. When to see a veterinarian. Because tick-borne conditions can sometimes take days or even weeks to show symptoms after a bite, any unexplained stiffness, fever, or swelling, especially in a dog with known tick exposure, deserves a veterinary evaluation. Prevention tip: Keeping a simple log of when and where your dog spends time outdoors can help your veterinarian connect symptoms to potential tick exposure much more quickly. If you're finding this information helpful, let me know in the comments what kind of pet you have. I love hearing about your companions. Warning sign number 7. Hair loss or thinning coat. Real story. Milo, a 2-year-old mixed breed, developed a small bald patch near the base of his tail. His owner initially thought it might just be from rough play with the family cat. Veterinary explanation. When a dog scratches or chews at one area repeatedly, the fur in that spot can thin out or fall away entirely. This is often the skin's way of showing that something underneath has been bothering the dog for some time. Possible causes. Localized hair loss may be associated with flea irritation, allergic skin reactions, or other skin conditions unrelated to parasites entirely. What owners should watch for a bald or thinning patch that continues to grow, skin underneath that looks red, flaky, or scabbed, increased chewing or biting at the area, behavior changes like irritability when the spot is touched, when to see a veterinarian. Any hair loss that persists beyond a few days or that seems to be spreading is worth having examined so the underlying cause can be properly identified. Prevention. Tip A, simple, consistent grooming routine helps you notice subtle coat changes early, long before they become larger patches of hair loss. When this becomes an emergency, most flea and tick-related concerns are manageable with timely veterinary care. But there are certain situations that call for immediate attention, not a let's wait and see approach, but a trip to your veterinarian or the nearest emergency animal hospital right away. These include difficulty breathing, collapse or sudden weakness, repeated vomiting, seizures, suspected ingestion of a toxic substance, including certain medications, inability to urinate, severe or uncontrolled bleeding, a visibly bloated or distended abdomen, loss of consciousness. These signs may not always be directly related to fleas or ticks, but they represent situations where the body is under significant stress. Time matters in these moments, and immediate veterinary care gives your dog the very best chance at a full recovery. Bringing it all together. Let's recap the key warning signs we've covered today. Sudden or frequent scratching, small dark specks in the fur, a new bump or something attached to the skin, red, irritated patches, pale gums or unusual tiredness, fever, stiffness or swollen glands, and unexplained hair loss. None of these signs on their own mean something serious is definitely happening, but together they form a pattern, and recognizing that pattern early is one of the most powerful things you can do as a pet owner. The goal isn't to worry you, it's to help you recognize when your pet may need extra attention. The earlier problems are recognized, the better the chances of keeping our pets healthy and happy for years to come. If you enjoy veterinarian-approved pet health education, subscribe for new videos every week. Together, we can help our pets live longer, healthier lives. This video is intended for educational purposes only and is not a substitute for an examination by a licensed veterinarian. If your pet is sick, injured, or experiencing an emergency, contact your veterinarian or the nearest emergency animal hospital immediately.